So, welcome back to Taking Charge of My Cancer podcast. And I have a really special guest today. This is Dr. Jessica Drummond. She's the founder and CEO of the Integrative Women's Health Institute, the Outsmart Endo Health Coaching Program, and the creator of the Women's Health Coach certification. She's passionate about caring for and empowering people who struggle with women's and pelvic health concerns. She's equally passionate about educating and supporting clinicians and wellness professionals in confidently and safely using integrative tools to transform women's and pelvic health care. Dr. Drummond has 2 decades of clinical experience as a licensed physical therapist, clinical nutritionist, and board certified health coach working with women with pelvic pain, including endometriosis, vulvodynia, and bladder pain syndrome. She brings a unique conservative and integrative approach to support women to overcome hormonal imbalance and chronic pain conditions. She's a sought-after international speaker on topics such as integrative pelvic pain management, natural fertility options, optimal hormone health, menopause, and female athlete nutrition. So, Jessica, thank you so much for being with me here today.
Thank you so much for having me.
All right, so you want to tell us about your journey into physical therapy and what led you to expand into clinical nutrition, health, and wellness coach. It's kind of like a nice, like you don't see that a lot in a lot of physical therapists.
Yeah. So I started my career, I thought I would be doing sports medicine. I was an athlete my whole life, and I still am an athlete, although I had about a 5-year journey with long COVID. So that derailed that a bit. But I'm still, now I'm back able to exercise more. And, as a kid, I was a gymnast and I enjoyed sports, and I still do. And so I started my career in orthopedics, and then I quickly kind of transitioned to women's and pelvic health in the sense that through a physical therapy lens, women's health is really orthopedics in a woman's body, including looking at pelvic health, looking at shoulder issues and rib issues and neck pain, of course, related to breast cancer, as you said. And then pelvic health, I think, really integrates the whole body. So I began to work with complex chronic pain and endometriosis, vulvodynia, bladder pain syndrome, which you can't deal with in isolation, right? Women with endometriosis often also have things like hypermobility syndromes, mast cell activation syndrome, dysautonomia, chronic pain, chronic fatigue, sometimes ME/CFS, sometimes there are hormonal triggers, sometimes there are inflammatory triggers and immune triggers, sometimes all of the above. And so I began to have to kind of strengthen my integrative lens so that I could think about the nervous system, the immune system, the neuromuscular system in a very flexible way. And a lot of it also had to do with digestion, gut microbiome, and so how my clients now think about their stress and their lives and their goals, and then each of their physiologic systems, from their nervous system to their immune system to their digestive system to their musculoskeletal system. What we've learned, well, I don't think we've quite learned this generally, but what I learned through the course of my career is that this idea of just isolating the body into the musculoskeletal system, for example, as an isolated silo within the system, and then somebody else will deal with your brain, and somebody else will deal with your gut, and somebody else will deal with your immune system. It just physiologically doesn't work that way.
Mhm.
So I've been doing this now for nearly 30 years. So I've just gotten more and more flexible, open-minded. I've had to learn a lot of things. I've been teaching professionals since about 2006. Well, really, even earlier than that. Because I think we all need to be more flexible in our thinking, because rarely do any of these issues happen in isolation. You mentioned earlier that you focus a lot on helping women recover from breast cancer.
Mhm.
So there's the surgical recovery, there's the hormonal shifts, there is an immune system transition. I was talking with a family member of mine earlier today who does have cancer. And for example, one of the minor shifts we made as he's going into chemo infusions this week is eliminating sugar and putting him on a low carb, not a ketogenic diet, but a low carb diet, and really focusing on sleep and the rhythms of sleep. And he went from requiring narcotic pain medication to dramatically reducing that
Right.
within like 4 days.
Wow.
So we have all of these tools, but I think what's overwhelming for patients, particularly those who are navigating cancer, is that it ends up being like there are so many things they have to do that they need people's help to kind of someone on the team. And that's where health coaching really comes in. And that's why so many of our students are physical therapists who then kind of layer on health coaching to their physical and occupational therapists. We have a lot of mental health therapists, nutritionists, dietitians, because I think those are perfect practitioners to layer in coaching to help clients really navigate the complexity of managing a complex chronic illness, because the system doesn't really have someone designed to do that. And, most of the physicians just simply don't have the capacity whatsoever. Their visits are very short.
Mhm.
So that's why, I expanded from, layering nutrition and functional medicine, lifestyle medicine, and coaching skills on top of physical therapy.
Got you. So what is your typical day looks like for you in a, multidisciplinary or integrative wellness setting?
Well, how I work with clients now is we work with women who are in the perimenopause to menopause transition. So generally women ages 40 to 60, slightly older than 60, and who also have, because the reality is almost all of us, by the time we're in our 40s, about 85% of the data, which I think is a bit of an underreport, but most of us have something else going on. We have an underlying autoimmune condition. We have a history of concussions. We have migraines. We have some degree of chronic pain, chronic fatigue, or some, complexity of things, endometriosis, whatever. And so we work with women with that level of kind of complexity in their health challenges
Mhm.
in a group model. Because as we mentioned, a lot of what we have to do is really help people navigate both the day-to-day self-care, like what do they do first thing in the morning? What's their morning routine? What are they eating? How are they moving?
Mhm.
What's their sunlight exposure? What's their bedtime routine, sleep quality, et cetera, right? So in our groups, we both support the person to kind of implement those day-to-day things that can help them feel well and implement the schedule of how they help integrate all their other medical team and even sometimes find that medical team. And then we do it in individual, but also in a group model so that they really get to kind of cheer each other on, have some peer-to-peer momentum. We were always celebrating
That's great.
gains. We're always thinking about like what's each person's vision, like what does health mean to them?
Okay.
And so we do all of ours through telehealth coaching model. And so I do that group weekly. And then the rest of my time is spent educating professionals. I build out a lot of professional education programs.
Mhm.
I work with my professional students 3 times a week. I work with our team and our faculty, and I'm also running the business, the financial side and marketing and sales and all of that, those pieces as well. And just, keeping the lights on, if you will.
Yeah.
Um,
Hopefully somebody's doing a health coach for you as well.
yeah, I mean, I think I've been lucky enough to have a lot of people supporting me. And so the pace is not at all overwhelming. I'm very mindful to take care of my own
Yeah.
health and have other people supporting me in that regard, because you're right.
Mhm.
as a health coach or any of the allied professionals I was mentioning, any healthcare professional, you have to be resilient and healthy and supported enough to really hold that safe space for others. Otherwise, at some point you're going to burn out.
Yeah, totally, totally.
Mhm.
So, how you're integrated physical therapy with nutrition and lifestyle medicine in your health and wellness coaching? So, I know you already kind of mentioned all that together. So, one just kind of comes hand by hand, right? Do you,
Yeah. Mhm.
do you,
And we basically look at, for each client, there's going to be priority, right? Some people really don't have to change much about their nutrition, but they do have to change how they're moving their bodies. Or, quite frankly, most of my clients over 40 are in that kind of midlife time range. The most important thing I'm teaching them to do throughout the day is rest,
Mhm.
recovery, learning how to have boundaries and saying no. And all of those things are really hard. So that's actually a lot of the work is sort of what examining really carefully what can we let go of? What can we receive support with? How can we collaborate and kind of do things more in community? Because, I don't know about the women in your life, but almost every woman I know in kind of the midlife time frame,
Yeah,
it's less about that they're not doing enough.
they doing too
It's
much?
that they're overdoing
Yeah,
or focusing on the things that they either don't want to be doing or really are not the best use of their time and energy based on their goals.
yeah, yeah. You're right. You're right. And sometimes what I'm dealing with is that same woman that you're describing on top of a cancer diagnosis. So,
Absolutely, which is another full-time job, right? The
yeah,
appointments,
yeah,
the
yeah,
chemo, that is very difficult.
it is. It is.
And I'm sure you see this all the time that your clients really struggle, even in that situation, asking for help.
Yeah, yeah, exactly. And that's one thing I always tell them, it's like you need to reach out. But again, all of us, we tend to just don't bother people, right? We feel we can do it all, right? We don't need
Yeah.
help because we can do it all versus really try. And I hear that for every patient when I have interviewing some patients. And
Mhm.
that's the first thing they say, like that's their advice to other people is what I learned really was a hard way to learn it is I need to ask for help because when I get the help, I feel so much better. So it's like, yeah, then why just wait? But again, it's different to be in their shoes, right? And try to be the one doing it all and now asking for help. So sometimes that's help. That's difficult to do.
Well, and I think as practitioners, that's why it's so important for us to learn and practice the skill set of coaching because coaching is a skill set where we can really sit with people in a way that helps them even safely and effectively think about like who can they ask? What are the risks of doing that? What are the benefits? A lot of times we're just like, ask for help. And then people are like, but how and who and how much? And
Yeah.
there's very few health professionals that are dedicated to helping people slow down enough to answer those questions.
Yeah. Yeah. I don't think I know anybody actually. If I'm looking back in like, yes, in our system, of course, nobody, right? And that's going to be really hard to find in a traditional medical center. But even
Yeah.
looking into like just Gainesville where I am, yeah, we're getting more into like some, I don't even know if it's a specific functional medicine physician here, but we're having more people into wellness medicine. And I think that, we have more and more of that coming up, which is a good thing. But I don't think I've been coming across a health coach really and
Yeah.
in this area.
A
And
lot of times people have to search for them themselves. And
yeah,
the good news is many health coaches work via telehealth. So there's
yeah,
some flexibility and access. But this is also why our organization not only focuses on training only, people who are pure health coaches who have played a really important role, But we also train a lot of physical and occupational therapists, nurse practitioners, nurses, acupuncturists, people that are seeing chiropractors, these patients anyway,
Mhm.
sometimes have more time with them, such as, again, for example, dietitians, physical therapists. You might have 45 minutes even in a rushed, or at least 30 minutes even in a rush, hospital system, for example.
Mhm.
But then you have more time than maybe the 3-minute appointment that you get with your gynecologist or your primary care provider or something like that.
Yeah. Yeah.
So you, as a physical therapist, for example, could maybe slow it down. Once you learn the skill set of coaching, you've got 10 minutes at the beginning of each session where you're really going to focus people on their goals, their support network, their short-term goals, even just for the week. Because you're right. I mean, it is ideal if someone has fully the attention of a health coach at
Mhm.
least once a week. I mean, once a month, but ideally once a week, especially through the cancer journey. And there are a lot of health coaches who specialize in cancer. But if you can't get that, if you don't have that option, this is where I think, physical therapists, dietitians, and so forth can step in. So, for those of you listening, let us teach you the coaching
Yeah.
skills and the hormone piece and all that, because you can be such a valuable member of that team.
Okay, that's awesome. Um, in your experience, what are the most common issues women face that require a more holistic approach? Or in
Well, I think, any chronic illness, and in reality, cancer now is a chronic illness,
Yep.
generally. Obviously, there are more aggressive, more acutely life-threatening cancers. There are cancers that are less aggressive and less life-threatening that can be fully cured. But there's a huge swath of cancer in the middle that maybe people aren't going to get like a complete cure necessarily, but they can live for many, many years, decades even, having to manage their condition. So, coming from a background of working with people with complex chronic illness, such as endometriosis, long COVID, et cetera, I see cancer in a very similar way.
Yep.
And so, I think, utilizing the skill set of lifestyle medicine and nutrition helps give your body the energy and the resilience, not only to just tolerate treatment, but to be really mindful of, okay, I may be living in a sort of suboptimally healthy body right now,
Mhm.
but I'm still healthy enough to live my life at some level.
Mhm.
And I think it's really important to think about it that way. We tend to think of health and illness as a binary, but
Mhm.
the reality is there are Olympic athletes who are struggling with mental health challenges
Mhm.
or overuse syndromes or, shin fractures or things like that, right?
Yeah.
But on many levels, they're very, very healthy.
Mhm.
On the other end of the spectrum, you know, there's death, if you will, but health, there isn't like an optimal.
Mhm.
And so many, many people, roughly 85% of the US population right now, are living with a chronic illness.
Yeah.
Cancer could be one of those. And so, how you choose to define health makes a huge difference to how you can be living, even if you're actively undergoing treatment. And then we use nutrition and sleep and supplements and movement and just even more like outside time versus screen time
Yeah.
to help mitigate the symptoms, but also strengthen your mitochondria and your nervous system and your immune system such that you have energy more of the time. Maybe not all the time, like 25-year-old energy, but
Yeah. Yeah. But even it's not even about age either, right? How many times now
yeah,
we're seeing younger and younger, 25 years old with the health
100%.
issues.
Yeah, I mean, you certainly could
Yeah.
be.
Yeah.
Yeah, you certainly could be a young person with a chronic illness. I mean, we have many people in our practice with endometriosis at 12, at 15,
Oh, wow.
and cancer is in children as well. So Correct. No matter the age, there's this idea, and I say this all the time to my patients. You are healthy at some level because you're alive. So instead of thinking like I'm sick, say I'm healthy and getting healthier.
Mm-hmm.
I mean, when I was working in inpatient many, many years ago at Duke Hospital, I was working on the cardiopulmonary floor for some time, mostly just because it was next to the complex labor and delivery area where I was working as a women's health PT. So sometimes I got called over into cardiopulmonary. And this happened to be Easter Sunday. And I read this woman's chart. She had had a pretty serious heart attack. And it was like her third one. Her chart was this thick. You know, she had had a lot going on. She'd had many surgeries. Like if you just read her chart, you would think walking into her hospital room, she was going to look pretty rough, pretty
Yeah.
sick. I walked into that room. She had two friends there who had brought her a little Easter plant and a special dinner or something like that, like a little food. She was sitting up in bed. She was weak, but she had a little bit of makeup on. You know, she was probably in her 80s.
Oh, wow.
And we got up. She walked a little bit. She sat in the chair. She visited with her friends. You know, she couldn't run down the hallway, but there was a level of health there because of her social support,
Mhm.
because of prioritization of nourishment, both food and just life. And she had a very positive, just
Attitude.
nervous system. She had a calm nervous system.
Mhm.
And those three things can really result in very significant improvement no matter how serious the underlying condition is. So that's where we begin as we think about what are some of the things that people have the capacity to change. Maybe they could have a more regular bedtime. Maybe they could spend 30 minutes less a day on screens and 30 minutes more a day just sitting out in their backyard. Maybe they could spend a little less time, you know, watching TV and a little more time enjoying art. These little shifts and adding more anti-inflammatory nutrition, taking a little walk. If they can't walk, maybe they can go in a pool and float a little bit and walk in the pool. You know, we have a lot of options once we take the time to kind of slow down and see where that person is, where they want to be, and what feels easiest to change first.
That's very good. That's a very good point. And you're right. Sometimes you can have as well that healthier person, right?
Mhm.
But their level of stress is over here. So this is what I hear a lot in my patients, right? We're talking about 30 years old, totally healthy, workout, super conscious about nutrition, overall healthy, and they're like, why did I get breast cancer from? Right?
Yeah.
But then they live in that stage of like up here, right? With their cortisol levels are up to the roof, which is again, cancer is not just because you were not healthy to beginning with, but looking into that mental health. What is it that my body is taking that has to be able to get to a point where perhaps this is what things came from, right? This is maybe the part that was your weakness chain, that's maybe why this developed, right? We're still kind of looking into all that, but yeah, the whole balance is super important. Um,
Yeah, and I think it's really important that people don't ascribe too much to like, what did I do wrong, if you will?
very good, very important.
Because, you know, it was funny when I first had long COVID, I was really, really sick after being like I was super healthy. And then 2 weeks later, I was like
Oh,
really sick, you know.
yeah.
And of course, though, as I've learned more and as we've learned more about COVID infection, like we now know there's an intersection between COVID and hypermobility genes, even if you never expressed hypermobility. COVID and low estrogen. I happened to be perimenopausal at the time. So, like, I think there's two things here. I think one is that there's so much we can do to help build our own resilience and our own health. And genetically, you know, all of us have some vulnerabilities.
Mhm.
Stress definitely, and I think is probably the biggest driver of those sort of, like you said, risk factors to kind of
Yeah.
trigger things that maybe wouldn't have been triggered or maybe would have been less severe. It's really hard to know. But I think there's something that's really interesting about how we view healthcare in the United States in particular. It's very focused on individual responsibility, which is a very ableist perspective, right? It's like, well, I'm sick because, or I'm disabled, or I'm fatigued, or I'm injured because it must have been something that I did. Now, that's helpful in some level because we can say, well, how can we shift
Mhm.
and shift to some more healthy behaviors? But I think we shouldn't get stuck for very long at all with like, why are you sick? Most of the time, when you think about a population that has 85, 90% chronic illness rates, it's because of the environment.
Mhm.
Of course, you're stressed. It would be crazy not to be stressed
Yes.
in the current environment.
Yes.
Of
Yes.
course, you're
Absolutely.
stressed, you
Yeah.
know?
Yeah.
We live in a individualistic, capitalistic society. Like you've got to make a certain amount of money to survive. You've got all these social pressures. You've got, algorithms that all of us are addicted to. Like, of course you're stressed. This isn't your fault.
Yeah.
Of course you're not eating the perfect diet maybe all the time. And even if you are, you're also probably stressed. So,
Yeah.
and
Yeah.
again, should we try to actively change that? Yes.
Mhm.
And I think there's no benefit to sort of the self blame of why did this happen to me? Da, 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 da.
Yeah. Yeah. That's right. Yeah. So how do you think that what is the common nutritional deficiency that you see in female patients and how do they affect physical performance or recovery? What would be your advice on that part?
Yeah, I think the biggest deficiencies tend to be things like vitamin D, which is really, really important for immune function.
Mhm.
Also magnesium, which is very important for calming the nervous system, sleep quality, and also bowel function. We want to be like daily detoxifying. I know that's kind of a loaded word, but your kidneys, your bowel, your liver need to have the nutrients they need to function to eliminate toxins as much as possible. Fiber is really important in that aspect as well. We all have microplastics in our body, some at a pretty high level. So fiber is one of the few things that can really kind of bind to those and help them be removed. Also, other forever chemicals like PFAS bound by fiber. So a high fiber diet is really valuable. It's also really valuable for diversity of the gut microbiome. And I think the other thing women don't do enough is eat enough diversity of plant foods. So, especially when we're talking about cancer, all the different colors, we want to eat. Like the other night, we had purple potatoes and yellow and red tomatoes and onion salad. And we have white onions and red onions. And I put basil in there and oregano. Like, I think a great fun goal is to try to eat 30 different plants per week.
Oh,
And
wow.
this can include teas and herbs and spices and beans and fruits and vegetables. Berries are really valuable. Beets, beet powder, like anything that has that full range of color from white onions and garlic to purple potatoes and blueberries, you know, really play with it. And I think that can make it fun. And it's a really nice way to make sure we're being less nutrient deficient. Because it is those micronutrients. Of course, we need to get adequate protein, but one of the things we're not talking about enough, I think, is those different micronutrients from a wide diversity of nutrition. And one of the easiest ways to do that is eating seasonally
Mhm.
because through the year, you'll have, for example, in the summer, you might have more berries. In the winter, you're going to have more, pumpkin and squashes and apples. And so you start to get that diversity if you really eat more seasonally.
And that will apply as well with like hormone imbalance. Is anything that you tweak it more with nutrition and hormone imbalance?
Well, when I'm thinking about hormones in perimenopause, it's a little tricky because your hormones are all over the place depending on the day.
Yep.
So we just want to make sure the body is able to process them. So when it comes to estrogen, again, more fiber. Estrogen is processed via the liver and the bowel. So more fiber, good hydration, protein, micronutrients. Progesterone, same thing. And then we want to have adequate fat in order to make healthy hormones. And so olive oil, avocado, wild caught fish, nuts and seeds, things like walnuts, um, really build are kind of those building blocks of appropriate hormone levels. And then we do want to think about inflammation. So I like to think in terms of adding, because when you eat 30 plants a week and you're drinking 80 ounces of water and you're getting 100 grams of protein and you're
Go
eating
for
wild
it.
caught
Yeah.
fish and omega-3s, like you don't have time to eat potato chips.
Yeah. Yeah.
But you can also think about you want to let go of things like ultra processed foods. One of the most important things to let go of for women in the menopause transition, particularly those who are at risk for or have had cancer or have cancer, is alcohol. Um, so, alcohol and any kind of processed sugar are probably the only thing I would eliminate fully, unless someone has, celiac disease or a dairy allergy and then the other thing I would be mindful of, depending on if they have active cancer or high risk of cancer, is I would also consider eliminating red meat, because that is carcinogenic. But again, the kind of specific eliminations are really person to person other than sugar and alcohol.
What are your thoughts? Because I've been listening, and sometimes you listen a lot about in nutrition, like carnivore diets, right? Sometimes they're like, yeah, for in the one hand, yeah, like red meat can be cancerous, but at the same time, has been some, big in carnivore diet and how that can help with heart and all these other things. So what are your thoughts on that?
Well, the only time I think carnivore diet can be valuable is people who have challenges with their immune system being overactive and chronically inflamed. And this is a little bit tricky because we don't really have enough data to say, like, this is the diet for that. What you're really doing with a carnivore diet is a very extreme elimination diet. Basically, you're just eating meat.
Mhm.
And so, for some people whose immune systems are hyperactive, they have MCAS, they have chronic autoimmune diseases, because you're putting so few diverse proteins in your body, that can temporarily rest the immune system in
Okay.
the same way as fasting. It's sort of like supported fasting. However, in cancer, number one, I would generally not recommend fasting because we need to keep weight on so people have the resilience to keep muscle mass, especially when they're going through something like chemotherapy. Um, and for surgical recovery, you need protein and amino acids, things like that. So, generally speaking, I don't see any evidence for carnivore diet, particularly for people with cancer. I think there could be a temporary place for it in other situations, but most of the time it's not my first go-to. I'd actually rather do short-term fasting, even for healing the immune system. There's a little bit better data
Yeah.
on that.
Like time limit fasting, like intermittent fasting.
Yeah, like maybe, anywhere from just doing 12 hours overnight up to like 3 days, maybe 5 days if someone's well trained for that. The challenge with fasting is you can't just jump into doing like a 5 day fast.
Yeah.
You have to have the resilience for that. You have to know how to eat when you come out of the fast. Um, so we have to be careful. But I think there are times when that can be valuable.
Yeah. I've been, there was some research out of Canada, and one of the medical oncologists recommended that to one of our patients. And And I have recommending that a little bit more, and definitely,
Fasting.
yeah, like intermittent
Yeah.
fasting
Hmm.
with chemo days, and that has been really helping with the nausea and
Mm,
really feeling like so fatigued. So that has been really making a difference. Again, usually has been happening in patients who already had doing some kind of fasting before. And,
hmm.
and some of the patients who never, I always kind of go start out with, just 3 meals, nothing between meals before you
Hmm.
actually go straight, like if you have never done it. Because I usually do intermittent fasting as well during,
Hmm.
in a regular basis, but I kind of tell them to just kind of really slow down into that. But, has been actually, we have seen a difference in how they feel. And again,
Yeah, that's great.
so just during that day of chemo, right? So then they just go back and then again be healthier and decrease sugars and carbohydrates and increase protein, those kind of things is what
Yeah.
we kind of advise them. Um,
Absolutely. And I think when we think about fasting related to people that have cancer, is we're looking at the metabolic benefit. That's why letting go of sugar, that's why generally low carb diets, that's why I have people not really eat at night, think about meal timing, maybe even more important than meal composition, although obviously both are important. Um, but the challenge, one of the drivers of cancer is metabolic challenge. And so many of us have metabolic challenges, particularly in perimenopause, because estrogen supports insulin sensitivity. So as estrogen levels decline, women do become just natural. You can be doing the exact same things you were doing, the same workouts, the same intermittent fasting, the same diets, and you can end up having weight gain. You can have blood sugar instability just because you've lost that supportive estrogen. So, there are certain red flag times. Stress also can make it difficult to be more metabolically stable. And so it does make a lot of sense to me. We're also seeing more and more research that, for example, people on GLP-1s are helping with healing from ovarian cancer. So I think inflammation and metabolic resilience are always important players when it comes to cancer.
yeah, and now that you mentioned inflammation, how do inflammation and gut health impact musculoskeletal pain and dysfunctions? So you work a lot with chronic pain.
Yeah. Really, I think the more anti-inflammatory someone's lifestyle is, the less pain they can have very dramatically. I mean, within days of needing less pain medication, less intervention, letting go of sugars and alcohol again, more exercise, more time outdoors, obviously wearing sunscreen at a certain level of being outdoors, not going sunburn, but being in nature also helps the release of interferon, which is an antimicrobial cytokine naturally in the immune system. And the other thing that's very anti-inflammatory, back to my patient at the hospital, being with people who are really caring about you and having those social connections. In fact, it's more dangerous not to have social connections than to smoke.
Hmm.
So, not that I suggest starting smoking, but we all know how bad smoking is. And having friends is even more important than that.
Yeah. So how do you empower your patients to take an active role in their healing journey?
For me, it always goes back to taking the time in the beginning and throughout our work together to get clear on their goals. Because when do you ever get asked, like, what do you want? you
Yeah,
know, what do
good.
you want to be doing? How do you want to be living? What does a great life mean to you? Let's start that now. And the more clear people are about that, they can really shift literally how much they enjoy their lives immediately.
Okay.
And then why they are getting healthy has a very personal meaning to them. And it's much, much easier to stay connected to, the kind of boring work of eating kind of the same thing for breakfast,
All the colorful food.
all the colorful foods, getting yourself outside to exercise, turning off your phone, calling your friends. There's some activation energy to being healthy. And when you're really, really clear on why, day to day, you want to be healthy. Like I remember one client of mine, she had two young kids. She was really sick with a chronic illness and multiple autoimmune diseases, and she was very fatigued. But she had been like an athlete and she was always playing with her kids. And she was like, the biggest thing I miss right now is like just being that active mom with my kids. And I said, okay, let's just start. They had a backyard pool. By when the kids come home from school, you just get in the pool with them because she had been so disconnected. She was like sitting, she'd watch them in the pool, so they were safe, but half the time she was on her phone. Like she just was not with them. So all she did was we started with be in the pool. And then it's like, oh, okay, now I have enough energy for 10, 15 minutes to chase them around the pool a little bit. Then we get out of the pool and we have a healthy dinner outside as a family. Then we're all a little more physically tired in that good way that we go to bed on time.
Mhm.
So
And
one little tweak
yeah.
begins to start the whole improvement cycle.
And where did you see the future of integrated women's health going in the next 5 to 10 years?
Well, I'm really interested for the next 5 to 10 years in deepening our students and clients' education on perimenopause, menopause, the midlife transition, and that intersection between that and chronic illness, because I don't see a quick path to reducing chronic illness, especially the way we're cutting science and all of that in this country. Like things are not going in the right direction. So I think we have a requirement and a responsibility to help people at this deeper level that we've been talking about today. And so our practitioner education is really my focus for the next decade. And I'm also going to be educating our students on how to integrate their work with AI, what that means,
Yeah. Nice.
because whether we like it or not, and quite frankly, I don't love it, but whether we like it or not,
It's helpful.
AI is happening. There are going to be things that could be really helpful about it, particularly with complex chronic illness. And I want our students to be ready because healthcare is going to shift quickly and dramatically in the next decade.
Mhm. That's great. And how can people contact you? And I'll have those on the show notes.
Yeah. So the best way to find us is just integrativewomenshealthinstitute.com or on Instagram at Integrative Women's Health. And feel free to DM me and my team, send us a message anytime, and we're here to support you.
Great. And she has a podcast as well for the audience. So I've been
Yes. We
enjoying
also have a podcast.
that.
Yes.
So that has been really great information. That's how I came across you. So
Yes, I love doing the podcast. We have awesome guests. Integrative Women's Health Podcast is where you can find that on any platform.
perfect. So thank you so much, Jessica, for doing this with me. I had a great time.
Thank you so much for having me. I appreciate it.
Have a great evening.
Thank you.